Hi, my name is Ellen Burse, and I'm a Bachelor of Kinesiology student majoring in Human Kinetics. I'm currently completing my fieldwork placement at the Dr. Paul Schwann Center as well as Alliance Health. After completion of my degree, I hope to go to school for physiotherapy, so I've been spending a great deal of my time during this semester working with Scott Anderson, who's a physiotherapist at Alliance. My special project is focusing on rotator cuff tear rehab exercises. After spending some time there, I got the opportunity to participate in an initial assessment for a patient who had a rotator cuff tear. So I was able to see her come into the clinic, the first exercises we prescribed her, as well as her progressions and how well she did as time went on. This is what helped me narrow down my project specifically to rotator cuff tears rather than just shoulder injuries in general. When Scott prescribes exercises to patients, he often uses a set of cards that show the exercises as well as gives brief instructions on how to do them. However, some of these cards are not entirely appropriate for the exercises he gives patients, and they often have to be altered. We will draw on them to change directions, add weights, or change the way the exercise is done. This leads to the purpose of my special project. I decided to put together a document for rotator cuff rehab exercises with pictures that appropriately show the exercises that Scott commonly prescribes. This document can be printed off and scanned and consists of multiple pages that coincide with the multiple progressions that Scott often uses for patients. It will also include a link to a YouTube video I made demonstrating the exercises and how to do them with correct form. One objective of my special project is to make exercise prescription easier for rotator cuff and other shoulder injuries by having appropriate pictures all in one place. The other objective of my project is to increase patient adherence and improve technique and therefore results by providing accessible instruction and demonstration for patients when they're performing their exercises at home. The timeline and planning of my special project ran over the course of the semester as I continued to understand the most commonly used exercises, as well as how to fine-tune their technique. Initially, I did not have an easy time planning my special project. My original idea was to just put together an exercise program for rotator cuff tears. However, I felt that this would not be of much benefit because Scott already knew how to do this much better than I could. It wasn't until I began working with patients more and more to review their exercises and realizing how often I found myself demonstrating proper technique that I thought of the idea to make videos to explain and demonstrate these exercises. This was a major adjustment I made to my project during the planning phases. Completing this project has helped me gain greater knowledge in shoulder injuries, as well as in function of specific rotator cuff muscles. I have also become more skilled at prescribing, instructing, and correcting these exercises, and working with clients has helped me gain personal skills and become more comfortable working with patients of different populations. In hindsight, something I might do differently for this project would be to give the program with the pictures and videos to a patient who has a rotator cuff tear partway through the semester. This would allow me to see the results and if the program was beneficial, as well as to get feedback from the patient and my supervisor. The most valuable thing I gained as a result of doing this project was practical and hands-on experience in a physiotherapy setting, which will hopefully greatly benefit my future endeavors. It was also very valuable for me to have the opportunity to apply this experience and knowledge to something that might hopefully benefit patients and the agency in the future.